Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And as always, we are back on Tuesdays and Thursdays at 11 a.m. Central answering your COVID questions. So as you can see, we have a special guest today. I'm really pleased to introduce Charles Norman. Charles is a community engagement support person at our Vaccine Operations Center. So he's been working with CDPH and with the big operation that's been rolling out vaccines, specifically on a lot of the community engagement. And we get a lot of questions from many of you about how to talk to people about vaccine, if they have questions, if they have concerns. And so wanted to bring Charles on, who has experience not just with vaccines, but actually with a lot of community engagement before. So welcome. Can you tell folks just a little bit about your background, kind of where you're from, and then what you're doing right now on vaccines?
Thank you, Dr. Arwady, for having me. I appreciate being on the show and talking with the City of Chicago residents at large. My name is Charles Norman. I'm from North Lawndale, born and raised. I'm 45 years old. I have 20 years experience working in North Lawndale, doing youth development, community organizing, and a number of things related with neighborhood enrichment and development in the area. I started out with Life Directions in 2002. Like I said, I was doing neighborhood enrichment programs, motivation, and mentoring programs for the youth. After that, I had an 11-year stint at Blessed Sacrament Youth Center, where I was the program director. And I worked with a lot of civic leaders and worked directly with the youth, mentoring and creating, programs that basically that were counter the violence that was happening in the neighborhood, off the street program.
Awesome.
We provided a number of things that were, structured around the benefit for the youth at the Blessed Sacrament Youth Center. After that, I worked with the Firehouse Community Arts Center. I was a life coach there for a year and a half. That's an anti-violence program, and their focus was around economics and ways in which we can counter violence and try to attack poverty and so forth, and promoting the development of young men who were at risk in that neighborhood. I also worked at Amazon, so I've been involved with the community in a number of facets, in a number of ways. Right now, I'm working at the VOC, as you stated, and I'm community engagement support. I started out as a project manager initially in March, I'm sorry. And I must say, I was in awe just walking inside the VOC. Just beginning initially, I didn't know what to think, what this job entailed. The hiring process, I just thank God that I was able to get the job. Miraculously, I was an employee, and when I first walked in, I was awestruck, looking at logistics, looking at planning department, looking at the fire department. I'm looking at communications front and center. I'm looking at Protect Chicago Plus. I'm looking at the medical staff. I didn't know this operation until so many different departments and so many hardworking people dedicated to serving Chicago and putting their lives at risk and trying to see others survive and live through this pandemic. So when I walked in, I was ready to turn back around. I'm literally not joking. I was ready to turn back around. I couldn't believe these, I saw so many multiple departments working in the concert, and the leadership, from Tamara and all of the heads of each department. But literally, that was my first initial response. After being there for some time, I was inspired.
Good.
Looking at the dedicated staff, and when I first started Tina, I remember meeting her, talking with her on the phone. That was the first person I had contact with, ensuring that my employment here was easy as far as the transition with the staff members and getting acclimated with what my tasks were. I definitely remember talking with Tina. I called her a couple of times. But yeah, she definitely helped me get adjusted those couple of weeks as the landing and so forth, with getting the tools I needed, and then also just in my initial first couple of weeks, Mike, I just want to say thank you to him and Nicole. Kendall, people from the various departments throughout the city that came over to the VOC to help.
Yeah.
You know, it was aviation as well. I could name a number of people. You know, even with Gabriella Warner Soto and Jessica Hernandez, Christina Papadal, those three ladies who spearheaded the Protect Chicago effort. Everybody was really warm and welcoming and just tried to make sure I succeed. So I was doing the project management. That was part of the mobilization of getting the vaccination sites up and running in areas. I know you guys already had the static sites and so forth. You already had, you know, like Soldier Field, I mean, just United Center and other locations, Wrigley Field.
Yeah.
The operation was massive. So when I came in, they were deploying vaccines to the medical providers.
Yeah. And
ironically, the area I was beginning to get started in was North Lawndale.
Perfect.
Wow. And having Gabby there and Christine and you know, Jessica, as far as my role of support and project management and working under them, I was blessed to have them and serve up under them now. They've helped me to kind of work independently now on my own in some aspects. And just being able to go back to my neighborhood where I'm from. Yeah. I was truly blessed to be able to do that and go back and be a part of this effort and work under this marvelous staff to help save some lives in the neighborhood where I'm from. So yeah, that's kind of how I started. The 1B, I guess, 65 and older, roll out as far as getting them vaccinated. Like I said, you saw the medical team, Candace and Dr. Rachel, and Faye and all those spearing up the strike force teams. You had logistics and Emily, you know, and everybody. I mean, from operations, Emily, Chris, he's an imposing big guy figure. He made me feel right at home. Emily, especially her inspiration. You had logistics, Bethany and Neil, always welcome and give me a fist bump. I remember he left. You know, we had, you know, you had so many different people there. It was just, it was like a close-knit friendship, family in our environment.
Good, I love it. So first, can I just say thank you, not just for the work you've been doing with vaccines and the Vaccine Operations Center, but for 20 years of like really critical work, you know, with youth and working against violence and all of that. So thanks for that. You don't know all of the people that he's referencing, but it's, you know, it's a sense of all of the different groups that have come together. And, you know, I know you mentioned as we were walking over here, you know, sitting next to a deputy mayor here and a scientist here, and just, you know, the Vaccine Operations Center has been this central location. We actually used a space for months out of Harold Washington Library that was closed to the public, but really large, so we could distance. And there have just been hundreds and hundreds and hundreds of people like working on this. So, all right. So I'm sure folks are going to have questions. That was sort of the background in terms of where you're coming from. But we're going to get into some of the work that you do when you're talking to people and thinking about, you know, what does it actually look like to be every day trying to work on promoting vaccines, including in some neighborhoods that not everybody's excited to get vaccines. So let's do a quick look at data. You can go ahead, as always, and put questions either for Charles or for myself in the box below, or you can use the hashtag AskDrArwady on Facebook or Twitter. So we'll look at the data and then we'll jump into questions and we'll take a combination of them for us, okay?
Awesome.
So chai.gov/COVID-, as always, is your one-stop shop for what's happening with COVID data in Chicago. As you can see here, just like on Tuesday, we continue to do quite well. We're averaging 460 cases a day right now. That's basically flat from a week ago. You can see we were 467 a week ago, and you can see this nice flattening. We're doing about 32 Chicagoans are getting hospitalized every day, up a little bit from last week when we were at 28 a day. We're averaging 3 deaths a day across Chicago. Of course, I wish that were 0, but 3 remains in reasonably good control, certainly compared to where we were in the prior surges before vaccine was available. We are back over 5,000 vaccinations on average per day, which I'm really happy about. We'd gotten as low as, shout out to you and your whole team. In early July, that average had gotten down to like 3,800. So it's nice to see it back over 5,000. We are doing more than 12,000 tests a day, which I'm also really pleased about. You can see that's essentially flat since last week. And in that context, our positivity also looks good. We're at 4.3% compared to 4.4%. We've actually kept that under 5% this whole surge at this point. So really pleased with the progress. As always, we showed on Tuesday, if you want to look back, I went over a lot of the other data that you can look at and how. I know we've been getting a lot of questions about kids. So if you click here on cases, and then come and look at age, you're able to really get some more details. Like, for example, if you say, I want to see what's been happening with kids, you know, basically July and August, you can highlight here and it'll show you how many cases, hospitalization, and deaths we've had by age in that time period. You can see here the blue line represents children 0 to 17 who continue to really be diagnosed with COVID at rates well below people in their 30s, their 20s, their 40s, their 50s. But we're obviously keeping a close eye. And if you want to look at what's happening with hospitalizations or deaths, here's how you can explore all that. Obviously, we're talking a lot about vaccines today, so this is where you can go and see what's happening with vaccination. You can look by age, you can look by gender, you can look by race, ethnicity, and then obviously you can look by zip code and see exactly what's happening week over week related to vaccination. So I encourage you to explore that, and I think for the sake of time, we will go ahead and dive into questions. All right, so let's start a little bit with you. So let's talk like straight away, because one of the main questions we get is how should I be talking to people who aren't so sure about getting the vaccine? So how confident were you in getting vaccinated? Talk about kind of that decision, and then some of, you know, when you're out talking to folks, which is what you're doing, and working to help organize a lot of the community outreach. What's some of the advice you give to folks?
Well, I can start off from originally myself getting vaccinated. Originally, the height of the pandemic, I wasn't vaccinated, and I didn't have any inclination. I mean, any thought about getting vaccinated.
Yeah.
I had been around some people that had got the COVID. I had been tested numerous times myself throughout the year, going back and forth to my doctor. I was also driving, doing the medical transportation of the business I was operating and so forth, trying to help out in my own way, get people to the hospital. And at that point, being not informed as I am now in that regard, but yet I'm going off, you know, my own self-judgment that, hey, I've been around people. I felt that I wasn't vaccine hesitant. I wasn't on the sideline. I was just reluctant. I'm like, I'm okay.
Yeah. I don't need it.
I don't need it.
Yeah.
I've been around people. And like I said, now it's good that I'm glad I was able to talk about the VOC and Tamara Mall. I remember she used to encourage me to get vaccinated. Charles was going to get vaccinated. She would ask my other contemporary as well to get vaccinated and so forth. But she would mention it to us, you know, randomly. So, you know, it was part of the inspiration as well. But one of the inspirations about me getting vaccinated, when I got vaccinated, was around the initial plan that we had for the vaccination buses. And Daniel Gregard, he was part of planning, him and Ed, and they were developing that, getting the buses wrapped, designed, and Sybil was there as well, and all the team had put in input, you know, if we want music or other just enhancements, incentives. It was just a lot of thought process, and I remember Daniel was spearheading. I was working with him, Gabby as well, and other community leads, engagement leads, and we decided that the first stop would be at the Atlas Senior Center. And I remember the first day over there, so many people came out to get vaccinated. The Senior Center was a great community partner in helping get into that neighborhood, blasting out the emails, and creating awareness and educating people about the importance of getting vaccinated and coming here. So they got vaccinated. I'm here working.
And you're not vaccinated.
And I'm not vaccinated. And like I said, I've been encouraged by the VOC, and also I'm thinking the people at the VOC vaccinated, I'm not vaccinated. So I'm at the site, long story short, I'm talking with people in the crowd, asking questions, deferring them to the staff, the clinical staff. Actually, Dr. Friccione is there as well, spearheading the vaccination efforts at Atlas Senior Center. She was there from the beginning as part of establishing that. And I really felt like I owed it to the people at that time to say, hey, you know what, let me take this as Cameron would say, the gentleman who works at the Atlas Senior Center, I would listen to my family say I'm going to take the sacrifice to see if having side effects, to make sure that it's harmless. I'll do this for my family. So I said, I'll do this for the people at the site. You know, you guys, I'm here. Okay, I'm going to take the shot. So I'll go through the process, you know, register just like them, like I was registering them.
So you registered while you were at work,
I registered while I was at work.
Love it.
I said I might as well be the example that they will see, you know, to give them insurance and inspire them. But yet I did it, went through the process, I got vaccinated, I did the observation, and then I went back to work. So I didn't have any side effects.
Good.
You know, so, but in that moment, that's when I got vaccinated. I also listened to Cameron. He was an inspirational at the Atlas Senior Center. He said, like I said, he wanted to do it for his family. He wanted to make sure that, show them that as far as side effect wise or, you know, anything wrong, that he said, hey, I'll be the example. I'll take this sacrifice for them.
Yeah.
So I was able to take my sacrifice for the people at the event. And the event, we got like 160, I think, that first time, and 80. And then, you know, there was a recall of Johnson, but still we had a lot of success out there with all the effort everybody put forth. That's what inspired me. The people, I'm like, if I'm going to be setting up the sites, you know, help managing them, you know, getting the community involved, let me just set the example first and show them, and that's what encouraged me to get vaccinated.
Yeah, great. And it's interesting because people have different motivations, obviously. There are some people who are really worried about their own health. You know, it sounds like that wasn't you so much. You said, I'm pretty healthy, or, you know, I've made it this far. I don't think I really need it. And it was really thinking about other people that made you make that decision.
And you know what, right now, even thinking about the people who ain't or aren't vaccinated, you know, having that sympathy, or compassion and empathy in regards to that. Some people might just be straddling on the fence, or, you know, they're venting at this moment because they're unsure about their health and they have concerns and, you know, other various reasons why they might not get vaccinated. So when you're talking to people, I try and, you know, garner their attention. I let them know I'm listening. I hear what you're saying when we facilitate conversations. Like, oh, I hear that you're kind of fearful right now about taking it. You just don't want to risk your health. I understand that. You know, let them know that somebody is actually not just discarding what they're saying in one ear out the other, but I'm trying to have a dialogue with them and lead them to the right answers they're looking for, actually. Because they might be in desperate need of those answers, just might not have the right words to express what they're saying, their emotions taking over. So just trying to be empathetic is one, and not isolating or trying to like censor people or put them in a box or punish them for not being vaccinated as well. You know, just trying to, whatever I do, I try and encourage people, you know, try and motivate individuals and lift them up, you know. So.
Yeah, and we're getting some good questions in. You know, first of all, a number of good shout outs to you. Woohoo, awesome job, Charles, etc. But also, but also, you know, some questions about, you know, what do you suggest when you know, I have someone in my family who is not willing to get vaccinated at this point. What do you suggest, you know? And some of this is what you're saying. It's about attitude, etc. Is there language you use that's specific? Are there, you know, tips that you have for folks who either are already vaccinated or in your case, you weren't vaccinated, at least at the beginning, and sort of being part of that conversation? You know, I completely agree with you. This thing of like not trying to judge, not trying to shame, but that can be, you know, at this point especially, I think some people are, if they've had these conversations a lot of times with family or friends. So, you know, suggestions that you have for people who are, you know, thinking about having these conversations in ways that stay respectful?
Look for small wins in your conversation. Look for those windows, like, okay, if they're not so adamant about getting vaccinated, you know what, let's start to build on the practices and so forth, social distancing. Using hand sanitizer, wearing your mask. Let's encourage, let's double up on those efforts. And motivate people in that capacity that might motivate them, or they finally might be inclined to get vaccinated. Because, you know, if someone's adamant about it, showing hostility at that moment, you know, you don't want to continue to trigger them or get them alarmed, or if they're raising political reasons or various other ways, you give them a smile and, you know, you just give information if you can. But for the most part, find windows where you can, of wins. So
I feel like you're on the same side.
Exactly, and like I'm empathetic with how you feel at this moment and what you're saying, and also it's a gradual approach. This is in a long term, this fight right now. You guys, everybody in it for the long haul. It seems like another year or so. There was a turn, and then, you know, things quickly changed with the variant as far as, you know, now. So we got to be in this for the long run. So don't, if you don't get that response you get now, don't stop trying. Just keep encouraging people. You know, just keep being there supportive. You know, they ain't changed their mind maybe at that point, maybe the next one. Just be constant in your approach. You know, when others are unsure about theirs, you know, you don't want to beat up the person. You know, let's attack the situation, you know, attack the problem, and let's bring education to that and practices and so forth. That's been a formula that's worked for me. You know, small windows and small wins with opportunity like that.
I love that. It's sort of, in medicine, we sometimes call that sort of harm reduction a little bit, right? Like this idea, you know, it reminds me of, you know, I'm a primary care doctor also, and so I talk to a lot of people about certainly vaccines, but also things like, you know, stopping smoking. And it doesn't help at all to try to shame people or browbeat them or anything. It's about, you know, what are your motivations, right? And like, let's have a conversation, you know, how likely might you be to think about this? What could you do to support? How could this be? Is there a way you could cut back, right? Even in, you know, so I think that's really good advice. And I'll just chime in this, you know, I obviously take questions from the public all the time, and people are always asking me, and you know, people who have not chosen to get vaccinated at this point, they're coming from a very real place of wanting to protect themselves, wanting to protect their families. And, you know, I got to trust that everybody is trying to make what they think is the best decision for, you know, themselves and their families and their communities. And, you know, I'm very data driven. I know that, right? Like I look at data all the time. And, you know, when I look at data here in Chicago, for example, and I see, you know, that people who are unvaccinated at this point are, you know, 10 to 15 times as likely to die if they get infected with COVID as people who are fully vaccinated. Like right now, right here in Chicago, like that's the kind of number that really gets me, you know? And then if you look by even subsets, and then especially as people get older, right? You look at people in their, you know, 50s and 60s, and especially, you know, Black and Latinx Chicagoans in their 50s and 60s are like 30 to 40 times as likely to die if they get infected with COVID at that age, you know, if they're unvaccinated versus vaccinated. So for me, like the data is really the thing that makes me feel very motivated towards this. But I know for a lot of people, the data is not at all, right? And it's more the conversations with the family or seeing someone who, you know, they've known for 20 years, having a conversation with them, you know, whatever it might be.
If I could chime in, actually, you know, part of the Protect Chicago Plus initiative, working in North London and Austin and other South Side communities, you know, Inglewood, West Inglewood. That's exactly some of the action items that were on the table as far how can we get the community to be the advocate. Peers, inspiring peers, individuals they're familiar with, talking with them in dialogue. And we were able to, the community engagement teams from each region, well, at the time, community, now we're, you know, Healthy Chicago, Equities, we're regional, but at the time at the 15 and the 13, you know, they were getting the community leaders involved, finding touch points, ways we can, like, I remember Elena and the teams from communication created the hyperlocal flyer, just getting out the information about where you can get vaccinated in your neighborhood, you know, bringing awareness to that, bringing that information to the hands of the community, so they are knowledgeable about where there's access, you know, where there's, you know, ways they can get vaccinated, because a lot of people thought, I can't get vaccinated, where can I go? And they were myths. So you saw a big push from the Vaccination of Chicago Department, Communications, creating pamphlets, materials, and so forth. Elena Hay, and you know, a lot of the team members of FCG, you know, in Georgia, I remember working directly with her, Martina, and so forth, and you know, just trying to empower the community. So just trying to empower each other, peer, inspiring peer in that capacity. I just wanted to touch on that part. A lot of community leaders got involved. They were at the table. They were actually trying to create ways to create conversation. To the ones that didn't, the young people who were like 18 to 34 who were, no, this is not for me, this is poison. So that was a great job I think everyone did in taking that approach to go get the people right, go touch the people right where they're at. Right,
and I mean, that makes me think of, I mean, you did youth engagement for so many years before that. Do you, you know, when you think about conversations that you're having with people, teenagers or folks in their 20s, are there things that are different when you're talking to people that age as opposed to when we're trying to do the outreach to, the folks at the senior center, for example? Like, I'm just interested in your perspective on that.
Well, you know what? I learned that you have to delegate. And remember I told you we brought in the community leaders. Actually, one of the people that we work with from the firehouse, actually from YMN, Tashana Edwards. She was part of the program at Bloodstream, so she was at the table for the discussion to help create the communication. I'm like, I might not speak their language.
Yeah.
So we all thought, let's get somebody who can. So I've talked with my peers of my age, and let me get somebody who's young. So that's what we did. We got people young to speak with them people of their age. So me, unfortunately, I can talk with them and have a conversation, but let's defer it to those who are better at their age.
Yeah.
But when I'm talking to them, I just try and direct them, to, the facts and so forth.
Right.
Young people.
Yeah, it's interesting. It's been one of the things. This age piece has been for me really interesting because we've even found, we've got a lot of folks who obviously are answering calls, and we have lists of Chicagoans who get particular services, especially if they're seniors, frankly, right? Who are at just the highest risk, and I am the most worried about if they're not vaccinated. And we've gotten a sense that often, even on the telephone, the older Chicagoans sometimes respond better to older callers, right? And, we've had over these last few weeks, especially heading into school, we've had a number of I had a 15-year-old on talking about talking with his peers. Yeah. Yep. But I think, I think it's as much about, there's the age thing, and in some cases it's about trust and shared experience. So certainly there are people who, someone in their family or someone in their church or someone in their community, but sometimes it's just about, is there some commonality? Is there some language that's the same? And I think where things have gone well, it's about people owning this and feeling like it's sort of their own. So
that's true. Can I add one more thing too? And then with the young people, pointing them, as far as in their spirit and with as far as their morality and their values, them having elderly in their household.
Yeah.
I remember, we were just trying to get young people to resonate with that as far as, the implication it has on risking getting somebody else infected, and just trying to use that as a proponent to encourage them to do something bigger than themselves that will affect their family, as far as getting vaccinated, to make sure they won't affect somebody else whose risk is greater than theirs.
Yeah.
So that was a big thing as well. Just looking at that. You want to do it for yourself, do it for somebody else.
Yeah. Christina Judge has a question here, probably partly for you and partly for me. She says, can you address what to say? I'll start with it, and then if you want to chime in. She says, can you address what to say when someone thinks they can have too many antibodies if they get vaccinated, but previously had COVID? And so basically, I think if this is someone says, I had COVID before, if I get vaccinated, maybe my antibody level will be too high. Maybe I'll have too much protection. And actually, what I would say to that is what I see when I really look at a lot of these scientific studies is that the best protection out there is actually somebody who has both had a natural infection from COVID and thankfully recovered and been vaccinated. It's the combination of those two, and I've shared on Facebook and along here some of the really good studies in the really good journals have looked at even in the bone marrow they've been able to see that there's really not such a thing as too many antibodies. Whenever your immune system gets a lesson in fighting off COVID, it will get that lesson if you get COVID, hopefully, if you successfully fight it off. But then it gets sort of a different form of the lesson when you get vaccinated. There's, of course, much less risk to yourself. You can't get COVID from the vaccine, but you're learning that immune response. And so I would advise that if somebody has previously had COVID, they certainly have some level of protection. They have more than if they've not had COVID at all. But the best protection comes when you do add the antibodies and the protection that can come with a COVID vaccine. So antibodies also, they peak shortly after you've either fought off an infection or been vaccinated. That's true for every infection, not just COVID. And so, for example, in the few weeks right after vaccination, your antibody levels are highest at that point, or after infection. But then they wane. They drop. But it's not all about antibodies. It's also about how your body, some of the other immune cells, they learn that if you get exposed again, they know how to churn out antibodies again. So it's not like there's one level that you hold all the time. They're gonna come up and they're gonna come down. And some of this booster conversation is recognizing that we're seeing some waning immunity, particularly in folks who are higher risk. So that's what I would say on the antibodies front. What would you add for people who are like, you know, I already had COVID, I don't think I need a vaccine? Do people say that, or anything you add to that?
I mean, you've pretty much addressed that, Dr. Hardy. A lot of times I do, if I'm not for sure and giving them the accurate answer, you know, I defer them to go to, you know, Covet vac site to get more information, look up the hospital's website to get more, you know, get a more educated response in that capacity. I just defer to someone's medical provider that you trust and trust with the right information they can give you. That's one of the things I would do. I'm not, you know, the medical provider for say, but if I'm not for sure, I would tell everybody to do that. You know, point people to a person like yourself who can give them you know, that type of information, antibody-wise.
Yeah, and I love that because it's true for anybody, right? Most people watching are probably not medical providers or public health backgrounds, and you don't feel like you need to have the answers to every question, but you want to point people to like sort of reputable sources of information. You know, I think that's one of the things. That's good. Okay, so Zaven Kaleshian on Facebook is saying, why do you think CPS stopped testing? $sign, $sign. So Zaven, CPS definitely did not stop testing. I'm not sure where you know, where you're getting that particular information. But in fact, there's been a lot of funding, federal funding, that has come not just to Chicago Public Schools, but to all schools across the country. So we got, we got more than $80 million just here in Chicago to support testing in all the schools. So Chicago Public Schools obviously got funding, but so did the private schools, the parochial schools, like lots of testing access there, because we know, you know, testing is not as good as vaccine in terms of preventing infections, but especially where you're talking about younger kids who have not yet had the opportunity to get vaccinated, it can be really important. So they definitely haven't stopped testing. And in fact, there is now, you know, even for students, if parents agree, you know, they can sign up and be getting weekly testing even if they're asymptomatic at school. So there's quite a lot more testing happening. So just to clarify that. Let's take Allison Hinderleiter on Twitter. So she says, I know it's difficult to track breakthrough infections, especially for those who had mild cases and didn't have to be hospitalized. However, I just tested positive, and so did 4 other people in my cluster. I wonder if it's more common than reported. Thanks. Okay, Allison. So I'm assuming that you are vaccinated because you're asking about breakthrough infections. And I just want to sort of speak to this a little bit. So anybody who gets a positive COVID test, every COVID test gets reported to us by law here in Chicago. So no matter if you get tested at a doctor's office, a walk-up site, a health department site, doesn't matter. Anywhere where you get tested for COVID, every one of those test results comes to the health department. And then what we do is with every single new positive COVID test, we match it to see, did that person have COVID in the past? Meaning, is this another infection? Because that can be a concern for a new variant potentially. But also, is this person vaccinated? And if they are vaccinated, then we would consider it a breakthrough infection. So it is true that there are certainly some, you know, quote, breakthrough infections. Somebody is totally asymptomatic, never gets tested. It's possible that, you know, I'm sure we're missing some, just as we have all along, that it has been possible for people to have COVID and not had symptoms like all along through COVID. That would also remain true. But the difference is, you know, for you or 4 other people in your cluster who are actually testing positive, that would be counted in what we consider sort of breakthrough infections. And then anybody who gets sick enough that they would need to be hospitalized, or although it's very rare, died, we do a lot of investigation there. So we're following up and looking at their records and really wanting to understand that risk. And that data is all getting shared up, you know, with the CDC and with the state as we're, you know, making decisions about things like boosters. So I hope that helps. All right. Let's see. I'll take a couple more science ones real quick. Rio Vili the Don on Facebook says, is it possible for the protein spike from the vaccine to break off the cell and travel in the bloodstream? No, it's not possible, and that's because the vaccine itself, basically, the vaccine does not hang around. All it's bringing are the instructions, this messenger RNA that does not get into the DNA of the cell, but teaches the cell how to produce the antibodies, the protection. And so it is not possible for the spike to break off and travel. It is not possible. I think when you're thinking about the spike, it's really more often it's the spike of the COVID virus you might be thinking of. That this picture, this electron microscope picture of the red with the spikes, that's the virus itself, not the vaccine. The vaccine is working and it can attach. The antibodies can attach and sort of help fight off the virus if you expose it after the fact. But the protein, spike from the vaccine, from the virus does not break off, and then no part of the vaccine breaks off in any way. And in fact, the vaccine itself is not, it only lasts like less than 48 hours in your body and then it's gone. But it has taught your immune system how to fight off COVID in the future.
I read that actually on the CDC.
Yeah.
Just trying to catch up, but yeah, I'm going to go home and read more about that as well.
Yeah.
So give a better informed answer. I definitely saw that on the CDC on the website.
Yeah. Michelle Lynn on Facebook says, what do you think of the United Center's decision to require proof of vaccination or COVID negative test to enter any of their events? So I think it is an excellent idea, particularly because it is an indoor venue and it's a large venue. And as you know, we have been here in Chicago really working hard to stay open and stay careful. And I think especially as we move into colder weather, these indoor settings, this is one of the most important ways that we can help keep them as safe as possible. What's your opinion on that? And feel free to have a different one for me if you do.
I mean, right now, and especially with the Delta variant and so forth, they're just trying to take measures to ensure, everyone's safety not put at risk and health. So I understand right now, but if it's better answers, I know the table is always open for suggestions of people to give, and it's just a measure just to try and ensure that this is, especially in an indoor, facility, that it's not passed on to others. So
yeah. I know it's controversial for people. When
it is.
It
don't sit well with a lot, probably.
Yeah.
Just trying to ensure people, not put at risk and not creating a mass hysteria of COVID outbreaks throughout our city.
Yeah, and in this case, they've taken that sort of intermediate where you either need to get the vaccine or the recent negative test, right? So it's not the same as everybody must be vaccinated, which is sometimes the even stronger stance. Recognizing that there are people, if they've still chosen not to be vaccinated, at least you want them to have that recent test. So
there's plenty of testing around.
There is, yeah.
Everywhere you go, it only take only a couple of minutes, to get tested. So I would encourage everybody to do that.
Yeah.
That's what I was going to actually say. Yep, just encourage people to get tested. Do that.
Yeah.
It takes no time, everybody.
Yeah, absolutely. All right, let's take one follow-up here from someone from last time who sent a study in, because I'd encourage people, if they had questions about masks, to send in a study. So this is Arizona Cards Lover on Twitter, who says, explain this mask study if they work so well, and has posted a link, and we'll pull it up. And then this person says, explain why you're touting the FDA vax approval when it was simply a license for a not yet released vax that was approved. Genuinely would love to know. So on the second part, I'm not entirely sure what you're asking, because always, if something is granted emergency use authorization, it's granted because it's an emergency, right? Like the Ebola vaccine, for example, would have gotten the same when you want to make a vaccine available while it's still going through some of the further full approval. But once it gets that BLA, once it gets that licensed, it is fully approved. And so this is not a different process in any way than we would have seen for any other vaccine. So and I'm not sure why you're asking about masks, as compared to vaccine approval. So I hope that answers the second part of your question. This is the standard of how not just vaccinations, but medications are also approved in this country. There can be an emergency use for a medication that then goes through the process and gets the formal biologic license, the BLA, like has happened with the vaccine. Let's take a quick look actually at the study that you're asking about. I think it's, let's see. Yeah, here it is. Could you mind just pulling up the screen here? So. Who wrote this article? Where was it published? Look for any sort of conflicts of interest, etc. So here, the authors declare no conflict of interest, which is good, because sometimes, if someone works for a mask company, for example, right? I'm not interested in reading that article. But in this case, we see that this is a published article, which is good. It's in something called the International Journal of Environmental Research and Public Health. And then you can look and see who the authors are. And anytime there's a published article, the first author, the one that's listed first, in this case Kai Kizelensky, is considered the primary author. So that's kind of how they do it. And then the last author, here Oliver Hirsch, is considered the senior author. And it kind of goes in order of who, like the first two authors usually will be the main ones who have done the work. And so I often want to understand, where is the journal coming from? So I did not know this journal off the top of my head, and I did not know these authors either, which is not necessarily an issue. So one thing that I do always, if I'm looking at a new article, is I go to this thing called Pubmed. If you've not heard of Pubmed, pubmed.gov, every single published peer-reviewed and published journal is in here. So there's more than 32 million articles in here, okay? Wow. Tons and tons. And this is where everything is gathered. You can look up my last name and look up everything I've ever published. And I just want to note, because a number of you sent in articles that actually have not been peer-reviewed or published, they're still in preprint. Those are, they're labeled, they're not sort of ready to go yet, if you know what I mean. And so first, you want to make sure something's showing up here and that it's actually been published. And then I would say, when I look up the International Journal of Environmental Research and Public Health, it has a lower, something called an impact factor. We won't get into it. It basically means how often are articles from this journal cited by other articles, and like how, kind of what is the level of awareness of them. And there are some journals that have a really high impact factor. So like if somebody publishes an article in the in JAMA or Nature, there are just certain articles, New England Journal of Medicine, The Lancet, that are very hard to get published in. So it's really the very best quality studies that really are showing new information or are important reviews that tend to get into those studies. And this one has an impact factor of 3, which is okay, but it's not a particularly well-known journal. But then it's published by, when I looked it up here, it's published by this Multidisciplinary Digital Publishing Institute, MDPI, and as soon as I saw that, not that you would know what that is, or probably anybody watching, but it actually is, it's an interesting group because it's the largest what's called open access publishing group. So they publish a ton of articles, but you actually have to pay to get your article published in this journal. So the people who write these articles, the authors, actually pay sort of the cost for the journal and everything, whereas some of the more well-established journals that it's harder to get your work published in, you definitely do not pay to get your articles published. So that's a little bit of background. And then the other thing is I always want to look up, what is the background of these authors. So like here, I'll look up, the name of this person is Kai Kizelensky, and so I look up Kizelensky, K, and I got to spell it right, K-I-S, yeah, so Kizelensky K, and I look it up, and yep, so here it is, right? Like here's Kizelensky K, here is exactly this article, and then I want to look and see what else has this author published, and I look, and he published in 2005 about repairing hernias. He were published in 2010 about bones and spines. He's published in hernias, muscles. So it turns out and those are his studies. He's a surgeon. He's a orthopedic surgeon. He works on bones and whatnot. And so is the second author. And so it makes me, I'm just interested that there's someone whose expertise is in surgery, then working to kind of pull together an article. And it makes me wonder a little bit, what made them decide to not use statisticians, epidemiologists, some of those others. So that makes me, ask a few questions. And then just the last thing I would say, it's really long. It's like 40-something pages long, which also kind of tells you that that's just unusual for a journal. They've really looked for everything, and if you look in the details of how it's been published, they actually just did a search for anything that had side effects and masks. But the actual conclusions, I'll just read from this because I did look at it. Like the conclusion here says, wearing masks does not consistently cause clinical deviations from the norm of physiologic parameters. What that means is that wearing masks did not actually cause any change in clinical values. So it says, for example, changes that do not exceed normal values. So they say it didn't go out of the norm, like the levels of carbon dioxide or oxygen or heart rate. Nothing in all of these studies. They didn't see that masks caused them to go outside what is considered normal, but they were able to see in some cases a small increase, but without going outside of the normal range. Okay. And so it's just important, I think, to not just sort of look at the title, but kind of read through the details of what's in here. And when they use words like subclinically, where it says the described mask-related changes can have an adverse effect on blood glasses subclinically means in a way that doesn't show up clinically. It doesn't make a difference in terms of your oxygen level, you know what I mean? And so, I'm happy when folks are looking at things that are published, and, I appreciate you sending me these articles because I like to see what folks are reading. But I would, there are a couple things about this just made me say, there were some statements that said there had never been reviews of this, and in fact there have been reviews. There's a review, for example, from The Lancet, which is one of the best known journals with a much higher impact factor that nobody's paying to publish the article, that's looked at more than 170 studies and really shown that the mask can be effective. And we've posted here before links to some of those studies. So I'm not trying at all, I don't want to get in an argument about, specific pieces, but I want to give you a sense of how I and people who have, training in medicine and public health kind of look at some of this. And I want to see ideally authors who have expertise in that area. So I want to see someone who, is used to thinking about epidemiology or public health or infectious diseases, frankly, and ideally has a long history of publishing in that space. I'm probably more interested in work coming from those authors as opposed to people who are interested in this, but their background, like in this case, happens to be surgery. I'm sure they're good surgeons. I'm not trying to sort of question that at all. But then I look at the journal and I look at some of the backdrop behind where folks can get it published. So that's a little bit how I think about it. I remain extremely secure, having looked at a whole lot of studies that masks are not dangerous physiologically and that they have played an important role. Vaccines are more important given the choice. If I could get everybody vaccinated, I think we could be done with COVID, right? Done with masks, done with the whole thing, but that's not where we are. And in that setting, masks do continue to play an important role. Nothing is 100% protective. So thanks to Arizona Card Lover who sent one in. Also thanks to at 300BLK out who sent 2 studies in, both of which are in that preprint. So they're not peer reviewed yet. We will take a look at them, but I really want to let you know that anything that's in preprint, it has not yet been peer reviewed. It's not been looked at by other scientists, and for me, the biggest flag is you want to make sure it's been peer reviewed and is showing up, and then we look at some of the rest of us. But thank you. I appreciate you sending things, and especially this Israel data from @300BLK out. I'd like to actually talk about this and some of the Israel data. Maybe we'll do that next week, because Israel is one of the countries we're looking at the most. Part of the recommendations for boosters is coming from what some of Israel is seeing. And like in this case, the one that you had sent along, and a lot of that is still in preprint because it's really new, is recognizing that where people have had natural immunity, especially from Delta, how vaccine immunity versus natural immunity is playing out. So maybe we'll come back to that. But I love it when people send specific articles or questions about articles, because I want to help you think about how we all look at this together. So I think we are just about at time, but I again really want to thank Charles Norman, Community Engagement Support with the Vaccine Operations Center, working on the Healthy Chicago Equity Zones. We did get one more just question in for you at the end here. What are you planning to do long term? Do you have ideas?
Just looking at the layout right now with how the Healthy Chicago Equity Zone is going to be coming forth and so forth. I'm hoping that I have a hand in that in some capacity, whether, internally with the city, externally with the organization, still involved in community engagement and community development. So those are some of my goals that I have, just to be in that capacity, involved in my neighborhoods in Chicago and development. Yeah. And making them strong.
Love it, love it, love it. Anything else you want to add just as we're wrapping up? Really appreciate your time and insight. Like, the work that you and that whole team is doing is absolutely critical, and I'm so happy we're seeing that rise in vaccinations again.
Yeah, thank you for your leadership. And Tamara, a lot of times she would always mention your name and say, I'm just reading what Dr. already said, but we know she's a great leader, and I just thank God for Tina and all the staff. I've been having a chance to work with now, working with Margarita Rihanna, epidemiologist, and Megan Mardo right now. She's moved on, but that was our operations lead. And Sierra, how you doing? See you later. She's moved on. Unfortunately, she did a great job initially, starting. My contemporary, and I always say hi to Daniel. It's just so many names.
You're giving I can tell you're an engaged kind of guy. You're giving all the shout outs. I
gotta get the shout outs. And thank you for what you just said, helping with the sphere of influence when you're reading documents and giving accountability as far as making sure that this is interest wise, it hasn't been swayed in essence. That was a good tool for everybody to recognize it. Then talking about Israel with their plans and rollout. So I just make sure I'm going to be following up with those type of things, keeping tabs, and but yeah, just giving a shout out to everybody I work with. I just want to say thank you for their hard work. If I can just, I can't begin to say all the names.
You've done a pretty good job.
I sit right next to Clarence, and Antonio and everybody. So Ina, all you guys, Stephanie.
I gotta tell you, this is how I feel too, right? You guys, you see me a lot as sort of, the face in some ways of CDPH, but there are hundreds and hundreds and hundreds of people who have just been working their hearts out, for a year and a half and more. And so I love your fit in all those shout outs. I think we're out of time for shout outs right now, but thanks again for, all the work you've been doing and, and for some of these practical tips. And I would just ask, keep having those conversations, right? You don't have to have all the answers, but having that open and respectful line of communication. I totally agree with you. Meeting people where they are, little wins, and having some alliance. So hopefully, you can have a really open and frank conversation about things like the decision to get a vaccine, even if you don't, end in the place you hope it ends. It's that conversation piece that I think is what we need. And keeping it civil is the other thing. I'm not interested in sort of shame and blame and fighting and all of that. That never, a lot of experience of encouraging people to make decisions for their health, and that is never going to be a way that works. So
Sow some seeds.
Sow some seeds, absolutely.
That's what we do, sow some seeds.
Yeah, and I'll just remind folks, if you're interested in some more tools for how to talk to folks, you can take the free Vaccine Ambassador course that's offered through City Colleges of Chicago, ccc.edu/Vaccine Ambassador, free for anybody in Chicago. Takes a couple of hours online. You don't need to have a medical background. It's really good. I would encourage anybody who wants to have the courage to have these kind of courageous conversations to do that. If we didn't get to you today, there were a few questions about flu. We'll hit some more on flu. I did that on Tuesday. If you want to look back, we'll hit it again next week. And also there's some questions about monoclonal antibodies. So I think next week also we'll do more about treatments, both monoclonal antibodies and what else has been happening in the treatment space. But let me tell you, bottom line is prevention more important than treatment. We've made so much more progress on vaccines and actually preventing COVID infection than in a lot of ways we have on the therapeutics. So thanks again for your attention. We will be back next Tuesday, and huge thanks again to Charles Norman. Have a great day, everybody.
Thank you, Dr. Artie. Thanks for your leadership.
Yeah, thank you. And we'll see you next week. Bye-bye.
Thank you.